Okay, so we appear to have time for public comments. What time is it? Okay, I'm going to ask Nicole to be a timekeeper. We're going to call in the order in which we've received the speaker cards. You have 2 minutes. I'm going to ask you not to cede time to another speaker. And I'm going to ask you that if you have previously spoken to this issue, then we would prefer that we save time for someone who has a new issue to come before us. So we're asking for concerns and comments about issues that you have not previously brought to the committee, and that you please refrain from discussing any identifying information with regard to the children or the people who were concerned. So with that, Lori Ford.
My name is Lori Ford. Thank you for allowing me to speak. I am disappointed that the DCS Ombudsman is not here doing the presentation. I believe at the last meeting it was mentioned that they would be here. I did speak with Casey Milsek after the meeting. She assured me that somebody from either her or somebody from the Ombudsman's office would be here at the August 3rd meeting doing a presentation. So I want that on the record that it's not happening. We also on the record, there's a pamphlet and a card regarding the Arizona DCS Ombudsman's office, and that's it. No presentation. I wanted to make this group aware that there is a huge movement, not only in Arizona, but in the whole nation, regarding child protective services. People are catching on. They are absolutely going forward, and since it is a private business, there are lawsuits with specific names, not the agency itself, which concerns me in regard to our schools. DCS goes into the schools. They speak with children without warrants. They speak with children without parents' approval. They remove children from schools. Now, our schools are a hot topic. And these people that are bringing forth lawsuits in the name of the private people in this private company
Time's up.
are also going to reach out and start naming the schools in these private lawsuits.
Thank you. Thank you.
I'm wondering if we can change it to 3 minutes.
Jay Griffin?
Thank you, Madam Chair and members of the committee. For the record, my name is Jay Griffin. Pursuant to Arizona Revised Statutes 8-459, the duty of this committee, advisory committee, includes informing the Department of Child Safety, analyzing current law and policy, and making recommendations to the department that improve and increase the safety of children in Arizona. In the interest of improving the transparency and accountability of the department, and as a person in the community whom this committee serves, I ask the committee at its next meeting to, number one, to move an advisory to the current director recommending the immediate cessation of warrantless searches and seizures by the department when investigating reports of abuse and neglect in accordance with Arizona Revised Statutes Title 8. Number two, to move, beginning within 30 days of the motion, the current director report daily on the department's public website a list containing the name with a unique publicly identifiable reference number of every child currently in custody of the department, a complete unredacted copy of the written temporary custody notice provided to the child's parent or guardian pursuant to Arizona Revised Statutes 8-823, a complete unredacted copy of the dependency petition for the child, an unredacted copy of the issued warrant or order authorizing the department's custody of the child, and an indication of the current placement status of the child, such as whether the child is in temporary custody, in-home care, foster care, group foster care, kinship care, guardianship care, missing, returning to family, severance, or other relevant classification. Number 3, to move an advisory to the current director recommending the immediate return to their family of origin every child who is currently in custody of the department without a warrant or custody order on public record. Thank you.
Thank you.
Thank you.
Steve Isham? Isham or Ishan?
Stands for I shame not. It's German English. I hadn't planned on talking for a change until I heard the gentleman from CMDP talk. Is my time starting now?
Yes.
Okay. I've worked in the behavioral health field since 1990 in one fashion or another, and I still advocate for children. In 1990, I served on the Dr. Ira Groves study and helped with the Arizona Vision and the 12 principles. Out of that came the integrated healthcare system idea. To do what this gentleman talked about flies in the face of that, all of that research and all that information. It puts in another administration level for 600 kids. They're going to create an entire administrative system instead of CMDP taking. One of the positives with CMDP was they knew what they were doing. They just needed to add some people with behavioral health that knew what they were doing. There's a duplication of case management with that type of a system. There's a duplication of quality management. And I can name a whole list of those. The other thing that worries me is it's a conflict of interest for providers to determine services. Provider agencies tell you what they've done based on what CMDP has given them. It doesn't depend on, them writing that. They do the treatment plan that's set up by the CMP case manager. They provide that service. For them to come back in and recommend services as part of CMDP is a conflict of interest. That outside administrative entity should not be determining services. The case manager and CMDP should be doing recommending those services.
Thank you.
Thank you.
Melinda Sherman?
Is this the seat, the hot seat? Yes. Thank you very much. I'm an advocate for many, many families and children for about 25 years now. And I have been asking questions of people, families who are facing severance. Everything's going along very well. They have completed all of their contracts with your stakeholders and your contractors. I guess we've identified about 465 contractors with DCS in this state. All parents facing severance, which is tantamount to a death sentence to a family when a child is removed. Forever, parents are not parents anymore. I ask these very simple questions of DCS, never get a proper answer. Have these parents ever been convicted of a crime? Have they ever been arrested? Have they ever served jail time? Many of them, thousands of them, have never even had speeding tickets. And yet, these courts, so-called courts, that thousands of people are starting to question the validity of your entire operation. I ask if these people who have lost their families have been able to face their accusers. No, they don't have a trial by jury, and yet they face the death of their family and the destruction of their lives, because DCS places people who have never had a parking ticket or a speeding ticket on something called a child abuse list.
Thank you, time's up.
Not okay.
Thank you. Carla Johnson.
Good afternoon. My name is Carla Johnson, and I'm an advocate. I'm a grandparent, and I have been fighting for change in this DCS system for about 10 years now. I wasn't here when the gentleman spoke about the comprehensive medical and dental program, but are you, members of this panel, are you aware that Title 45 of the Code of Federal Regulations, 46.409, that's section 46.409, says children who are wards of the state or any other agency, institution, or entity can be included in research. Do you know, are you aware of the fact that DCS, part of their agenda is to use these children that they take from these warrantless seizures from families to use as research? Are you aware that Phoenix Children's Hospital has a contract with DCS? For every child that Phoenix Children's turns over to DCS for custody, DCS pays Phoenix Children's Hospital $865. Phoenix Children's Hospital has a contract with TGen, that's Transnational Genomics Research. When is this going to stop? What gives the Department of Child Safety the right to take these children and use them for medical research? What if it was one of your children or your grandchildren? Would you be sitting behind here, or would you be out here with us advocating for this system to be completely abolished? Ask yourself that question. What would you do if it was your son or your daughter? You're not immune from this, even though you're in the system.
Thank you. Thank you.
Wake up.
Sergio Madrid.
Hello. Good afternoon. I'm Sergio Madrid. Hey, thank you for your time. This is my first time being here, so I don't know what to say or anything, but my family has been torn from CPS corruption, and I'm here to ask for help. We talked to Congressman John McCain's office, the Ducey's office, nobody's been able to help. Everybody knows what's going on. It's in the news. It's going on everywhere. Who can help us? I just want to tell everybody here, if you guys could put yourself 5 minutes in our situation and understand what we're going through. When the family has been torn apart, you guys have a loving, happy family. I had one too. Who can help us? We all know what's going on. Thank you.
Thank you. So that's the end of our comment. I want to ask the committee, when we consider additional agenda items for the future, if we might want to consider any of the questions that were raised or issues brought before us. And to make a comment, and we were not able to arrange to have the ombudsman here for this meeting. We will be having it at a future meeting, but the date did not work out.
So is it possible to have them in October?
Let me Ben, I think it's October that we're doing it. I'm having a little senior moment here, but
Yes, he's saying October.
yeah, we're going to have them at the October meeting.
And is the Family First Act going to be covered then too?
Yeah, that's up to you guys. I think that's one of the other agenda items we have noted for a future agenda. So if you guys want to add it.
Well, it's in our report. It says it was going to be in October.
Okay, then yes,
Okay.
we'll do that.
The Families First Prevention Act is a huge piece of legislation, and it fundamentally shifts attention to prevention and upstream activity to try to keep more families together, have fewer removals. We're doing some of this with the existing program, but under the federal change in the federal law, we'll be able to use Title 40 dollars towards prevention and earlier intervention, and towards longer-term stability and in-home services. But it does have a huge impact on the whole system. So I think it's probably going to be a 2-year implementation process. So we want to hear, the department I think is currently looking at what are the implementation options, but by October they should have a pretty good idea. So I think it's important because a lot of what we have discussed here with our various concerns are really being addressed at the federal level as well. But there'll be more flexibility. But it also requires an enormous reduction in the number of children who are in congregate care. It cuts off federal funding for children who are in congregate care more than 14 days, 2 weeks. So we need to gear up to have more family-centered care and fewer children in the system, and more support for families to keep kids at home, keep kids in the family. So if we have that for our next item, the Family First Prevention Services Act is quite comprehensive, so I think that would be probably a pretty lengthy, maybe 20 minutes or so. And then the ombudsman, Ben, remind me if we're going to have both of them, both the state and the DES. Wanted to have them here so they could really talk about each role. What is the state role? What is the DCS role? And I think that's going to be
Very helpful.
but also I think that's going to be an adequate agenda.
Yeah.
I don't think we need to add a full agenda. It'll probably take up quite a bit of the time. So I was concerned about the allegation with regard to research. Knowing what I know about medical research, I think it might be helpful to have someone come to address that issue for the committee. And that might be Dr. Park or someone from CMDP who's responsible for the medical
The
program.
governor is on the board, so he can address that. He's on the TGen board.
So would you all like to have someone come and just address that issue?
Yes.
Okay, so, and I think that could be a fairly brief conversation, but
The other one was speaking to children without the parents' knowledge. I don't know if
And
we
this-
want Catherine from DCS to talk about the rules and process as it relates to that.
do we need to have
Robin, are you
that?
talking about at schools? Okay. I don't think your mic's on.
Pardon?
I don't think your mic is on.
It's not, sorry.
Do we want to add that to that agenda or to a subsequent one?
You've already said that's a full agenda. Do we want to maybe move that to the meeting after that?
After that, which would be...
Or I'm happy to put it on a list for future, it doesn't...
Yeah, let's just put those on for future agenda items and we'll work it out. And I believe that the warrant, the pickup order went into effect July 1. July 1. So I think they're still operationalizing who's calling whom for what, but that is in effect.
Yes.
And it might be good at some point, maybe 6 to 8 months from now, to have a report on the pickup order process.
That's not a
Madam Chair, on that issue, I know it would be good to hear from Catherine because of her expertise on the law and the law change, but I know that you've got the law change, the statutory change, and then you've got how the courts are implementing it and their new warrant process, and so it's really the implementation, I think, that concerns this committee.
Yeah, I
whether
think
it's
that-
working the way it was planned and that type of thing.
So I would expect that we would probably need to put that off until spring sometime. I mean, they need at least 6 months of experience, and then you have to get the reports in and all that. So what do you think, Nicole, maybe?
I think it would be good to put it out till spring, and then we can see if we can get someone from DCS and someone from the court.
Yeah. I heard that there's still confusion about where the calls are going, so I think they've got some issues to work out.
But they are coming in.
They are coming in.
Yes, they are.
Any other items that we can work up towards? Any other items for concern? I do want to really encourage people to put comments in on the on this whole issue about CMDP and the behavioral health service. The RFI will be available through the Procure Arizona, but would it also be on the website? Could we put it on the website? For not everybody's on Procure
Yes.
AZ.
Yes, Barbara's saying yes.
Yes. Let's.
I have all the research. I could certainly send it to someone on the board. I have all the RFI numbers and everything and the contracts.
So we'll put the RFI on the on the DCS website, because this is a big change in the way that services will be provided to children with behavioral health issues, which is a significant amount of the population. Are there any other items for discussion are there any other suggestions for future agenda items?
So can I just clarify, we had one of the other ideas that we had for future agenda items was Morrison Institute presentation on recent findings around neglect. Do we want to prioritize that?
So we did at the last meeting kind of lay out when we would have them come, and it is in the report.
What page are you on?
I'm trying to find it. Page 11, under the June 2nd meeting.
DCS Guardian update.
Yes, so
I
in
was
that
looking at number
paragraph. So for the Morrison Institute, the last time we had suggested.
So October would be Morrison Institute, and we've already got a full October.
We have a full October, so I think maybe we would put them on for December.
Yes, we only have one day for December.
But maybe we can see if maybe we could put up, we could add maybe the Morrison and the medical research question. For December, if you,
And the dates are in the paragraph. for December, we only had identified quality child care.
So we could do that with the Morrison Institute. That doesn't take that long. The quality child care issue.
With the Department of Economic Security.
Yeah. The other thing that we will need to look at, in keeping with our goal to try to look at the strategic direction for the department, we probably need to have someone do an update on the strategic planning process for the department. Do any of you from the staff know where that process is?
It's not out yet. I think it should be out soon. I think in the next.
It should see.
Oh, that's all we have. That's what we have.
Soon? Let's do that for the December strategic planning review. I think that the Families First Act is going to set the agenda for the next couple of years. And there is a lot that is going to be happening over the next 3 years. We have the children who are currently in the United CRS program are going to be moved into the general children's population that will be integrated into the health plans. There are 7 health plans in Maricopa County. There will be 7. In other parts of the state, there will be 2 or 3. That's October 1. Then Families First probably will be implemented in 2 years, which would be 20, and they would also be looking at changing CMDP for kids in October 20. So, and in the process over the next year and a half, all the planning around the CMDP issues, because the REBAs were probably going away and then after 2 years. So currently, the children in the CMDP behavioral health program are staying with the REBAs for the next 2 years, but there will be a change. So there is going to be an enormous amount of change, dictated in part by the change in the federal law and approach, and then also with what's going on here in Arizona that will impact children. So I think we're going to want to try to stay up to speed in terms of what is going on that are kind of making these big changes, and then how do we make sure that those are being done in a way that people really know what's happening and can prepare for those changes. So we have agenda items pretty much through December. I don't know that we need to go beyond that, do you all? But if you do come up against things that you think are timely, let's work with that. Because I didn't want us to wait until the October 5th meeting and find out that the comments on the CMDP RFI had been due in mid-September. So we've got to make those adjustments. Are there any other issues to come before the committee?
I'd just like to say one more time, Nicole, very grateful for your efforts on the report. It makes a big difference to have you on the team.
You're here. Is there a second to the motion to adjourn?
Second.
All those in favor, please say aye. Aye. Opposed? Ayes have it. Thank you all.